open it up for questions?
Yeah, so why don't we switch gears a little bit and do question answer, and we'll take questions from the crowd, and I believe we're recording this, so if you have a question, just come up to the mic.
I'll make one other comment, and this is just through SAEM Foundation and Emerge ASAP Foundation. They have a fellows meeting every year, and they give out awards every year. And about 4 years ago, we were in discussions, and now they bring that meeting to Bethesda every January. And so the kids who are funded with these are now getting they're meeting 6 and 8 and 10 program officers. They're hearing about NIH. So it's 30 or 40 people getting involved every year at that level. Just trying to change the culture.
Yeah. Where is that meeting again?
Bethesda.
Yeah, Bethesda. So you have to go.
Toby.
So you have a taker. My name is Toby Negarty. I'm from Mass General in Boston. Thank you all for your...
Drop the mic.
Drop the mic. Thank you. Let the video pick that up. Thanks for your presentation. I wanted to flesh out a comment that Jeff made, and he gave a possible solution, but he mentioned the data point that there are roughly 40 T32s in cardiology and 2 in emergency medicine. And one argument for the slow uprise of research in emergency medicine that we are a clinical specialty, but cardiology is as much. The other is that we're a high-paying specialty, so the opportunity cost of our time is high. It's as true of cardiology as far as I know. Jeff's comment was that we're just a newer specialty. And my question is it really that simple, or is it more complicated than that?
At the beginning of my presentation, I've come up with the field the whole time, and you did take 30 years to get. It was cardiologists doing the research in the 80s and 90s, and then emergency medicine researchers really didn't start till the 90s. And by 2005, when they came to NIH, there were less than 30 people funded at NIH at that time. What else could it be? You have to get through the training programs. It's not, is there a lack of familiarity with the training programs?
Mm-hmm. Okay.
I can comment also, Toby, a little bit.
Okay,
I think, one of the stop gaps, or the bottlenecks, I should say, is you have to write one, and the people who are qualified to write the grant are probably fewer and far betweener than the cardiologists, right? So, but that'll take time. I mean, we are a relatively young specialty, and I think that as we evolve and our research portfolio evolves and the people who are interested in research get more experience, there's going to be more people who are going to be able to write these grants, and you will see more T32s cropping up across the country. It just takes some time.
Right.
I'm going to just make a historical perspective. I think circulation started as a journal in the late 40s, and the NIH started as an institute in the late 40s, and only studied infectious diseases initially, but one of the second things it started to study was cardiovascular disease. So I just think they're so far ahead of us in timing, just like what I was saying. And I'm just think of one anecdote. Like Lynne Richardson is the PI on one of the T32s. I mean, she almost got sucked up into being a chair at Sinai, and I'm glad she didn't, because we might have lost her as one of our, we'd have lost 50% of our T32s. I don't know, maybe she could have done both. I don't know. Maybe she has 48 hours in a day, but that was just an example of people that are capable get tagged to do other things.
Right.
I would like to throw out another comment on that. I think that there aren't enough EM people reviewing grants at the NIH. And the fact that when you submit a grant to the NIH and I have to ask, could you please add on an EM reviewer, because the other reviewers send back amazing comments. And I think that's something that we as a specialty need to change.
Fair enough, and I put in names all the time. Lynn was a T32 reviewer for 5 years at NHLBI. I got her on that committee, and I've gotten other people on committees. So if you know of anybody else who can review for NHLBI and research training and career development, let me know.
There is a website where you can jumpstart your grant reviewing career. It's called the Center for Scientific Review, and there's an email. I believe it's csrreview@nih.gov. But you can Google it, obviously. And you can submit your name. You can put in your area of expertise, and it goes into sort of this bin. And if a grant comes up or a study section comes up where they need somebody with your emergency care expertise, they'll give you an email and they'll invite you down. So you can definitely be proactive in terms of getting more emergency physicians on those study sections.
I've got one last comment about sort of the relative lack of researchers in emergency medicine. When I look back at the folks in my graduating residency class, this is just anecdotal. I don't actually have any evidence for this, but I suspect that in academics, the ability to do research increases your longevity, and it gives you some more flexibility and options in terms of career. From my graduating class, I think probably 50% of the folks who graduated are still practicing clinically, and the ones who left or who have dropped down to part-time did so for a variety of reasons. But none of the folks who went into academics and have any sort of research bent. I don't know if it's a chicken and egg kind of thing, but there may be some more opportunities for staying in emergency medicine longer term rather than just going to the community. That is not well shared with the residents.
You said that number again. You said 50%?
And it's a ballpark, but about 50% of the folks who I graduated with are no longer practicing clinically or are less than 50% clinic.
I'm pretty sure I'll get in trouble for saying this somehow, so I'm just going to go ahead and say, but you're like 30. So, I mean, and half of them have already out of it?
So I graduated in 2010, so we're 8 years out. And, yeah. And they're doing other things, right? So they're doing like entrepreneurial stuff, but they're not practicing clinical emergency medicine.
Yeah, right.
So you guys mentioned diversity in mentorship at your institution for the T32, and I would say one of the benefits for the current K-12 is the actual trans NIH support with the NIMH and NINR. This may be coming out of ignorance, but are there T32 opportunities that are kind of trans NIH that have multiple institutions or institutes that are supporting it?
No. The K-12 is it for trans NIH programs.
Yeah, the T32 at Sinai, and I can't speak for the other T32, is NHLBI. But thankfully, NHLBI can kind of be extrapolated to a lot of what we do in emergency medicine.
Jane, I'm curious, as healthcare systems are like the airline industries back a couple decades ago and quickly merging, at the Cleveland Clinic, we integrated and now have 21 emergency departments, and it's a very different system than it was a decade ago. Can you speak a little bit about the NIH's pursuit of research in the realm of operations, pop health, less about the bench research and more a bit about how we take care of large populations of patients?
I was trained as a health services researcher, so I think I get what you're asking. But NIH, we fit it in at the sides. People don't call it health services research. They add it onto studies. So it gets in there, but it's not headlined. Remember, you also have PCORI right now and AHRQ that also filled some of those areas. So NIH says they don't necessarily do it, but we can get things in the door. For example, for NHLBI in the last 5 years, we've been arguing that sepsis, to catch sepsis is to prevent ARDS. And so all of a sudden we're getting all these sepsis grants in because we finally have a catch how to prove that it's NHLBI. So it sounds silly, but it's a way in the door. Anything else?
Pithy to say.
Thank you for coming, and thank you for just listening. And I can tell you that, you know, my office, if you have anybody who wants to get a K award, they can call our office if it's heart, lung, and blood related, and I can triage them to an appropriate program officer. If they're heart, they come to me anyway. So other than that, but we can take K awardees. They come to our office.
And I've got some pamphlets up here
Yay.
about our T32 program if you're interested.
Thank you very much.